in the studio. I am now joined by the Group CEO, I wanted to say Richard Friedland, then I hesitated, Dr. Richard Friedland. Welcome, sir.
Thank you very much, Godfrey.
Gary stays, of course, with us. So I wanted to begin, first of all, by just talking about this relationship between you and the board in the light of the issues that we have seen cropping up in the press and being reported in the past few weeks. Given what appears to be, I was going to say, acrimonious relationship, how does that portend for the future growth of the company? And how are you handling that part of it to swing your shareholders back into line behind you?
Thank you very much, Godfrey, and I'm glad you've raised this issue because I think it serves to clarify that I don't think there was anything contentious. We had an annual general meeting. There were 14 resolutions passed with very, very significant majorities. In terms of one particular resolution around the re-election of a long-tenured director who had been on our board for a long time, he only garnered 63% of the vote in terms of the audit committee. And there are many companies and shareholders, quite rightly, that believe that potentially, if you've been on the board for a long time, there may be a question of independence, given what we've seen in Steinhoff, etc. And if you've been on a board longer than 9 years, certainly your independence on the audit committee is questionable. Now, we've taken that on board. Our chair of the board has already addressed it with the nominations committee, and we'll be looking to refresh it. But certainly we received approval on all of those resolutions, probably the highest we have in our history in Netcare.
Richard, yeah, I've got a couple of questions just about a little bit more general about I suppose the operating environment for hospitals, both locally and internationally. Obviously, we've got NHI coming in. I'd love you to talk a little bit more about that and how Netcare plans to address that. But also just from an international perspective, I mean, we're seeing a lot of other hospital groups. This is not a South African issue. We're seeing it in Switzerland. We're seeing it across the globe. How are the changing dynamics for private hospital groups influencing your business and just the growth of the sector in general?
Yeah, I think, Gary, that's an excellent question in the sense that I think healthcare is changing very radically globally, and a large part of what we're trying to do in Netcare is actually disrupting our model to fit in and to be aligned to that. I think the second part of the question I'd like to come to is that the private sector has an enormous role to play in helping capacitate NHI and helping to deliver decent and quality care to all and support government's initiatives, whether you call it NHI or universal healthcare. And so there is an enormous role, and I'd like to come back to that. In terms of the kind of positive change we are leading in terms of Netcare, the kind of care we give, if we had to be hand on heart, is pretty archaic. It's disjointed, it's disrupted. You see a doctor in a hospital, you get discharged, you go to a primary care facility, you don't necessarily have the records, everything is manual, and there isn't a continuity of care. And what we're trying to do in Netcare is to focus on that entire journey and say we're not just a hospital operator. In fact, we want to be involved at the primary care level, at the mental health level, where you have cancer, at the emergency, as part of the entire continuum of healthcare. And so we're digitizing our entire business. And the reason is we want patients to take co-responsibility for their healthcare. The only way you and I can do that is if we have an electronic record. We have an app on our phone that says this is exactly what's happened to us and becomes a health record for life. And so our big journey is to digitize this and to give it to patients and say, let's participate together with you in their healthcare. And that's a very significant investment. It's about an investment of about 600 million. And so we think we can be more efficient about how long people stay in hospital, whether they have to be in hospital or not, but that we manage that entire continuum of care and we can provide better care. I think when it comes to the NHI, if I may speak about that in government, there are really practical ways that we can assist government. We've put forward a proposal to help train more than 50,000 nurses. We've put forward a proposal to help train all the doctors that are needed. Now, of course, being in the private sector, there's always an issue of profit. So we've said, take that off the table and let's do that at cost. We've also said we've got spare capacity across the entire private sector. Let's use that for state patients. We've also said, practically, let's share best practice in terms of policies and procedures. What works in the private sector, what works in government, across the sector, so we can help capacitate management. And I think it's this joined up approach that can really move the debate forward meaningfully.
What are you hearing from the government on that front in terms of working with you? Have you put up structures that enable you to be able to have this exchange of ideas that you're talking about? That's the first part of the question. The second part, I wanted you to critique yesterday's budget in terms of the health sector and whether you had enough, in your view, that the government is serious about actually taking NHI forward.
I think the government is very serious about addressing the inequity in healthcare.
Yeah.
And we can't
with
build...
the money behind it.
Certainly, but we can't build a sustainable society if we don't have a healthy one. We all recognize that. We all as healthcare workers recognize that. I think government is constrained financially. We recognize that. And I think the positive aspect is a lot of the money set aside in yesterday's budget for the NHI is going to go to capacitate shortages of staff, particularly nurses and specialists in various departments. Is government taking the private sector seriously? We've had excellent engagement with the President and his advisors in terms of what the private sector can put on the table. And we really believe there's a role to be played in terms of that.
No, but would you set up the structures for you to be able to do this? Because meeting with the President, I mean, given the kind of role that he plays, is probably a one-off. But what about that infrastructure that's required to ensure that the ideas that you're putting up are actually carried forward?
So we're in the process of putting that a social compact or a health compact together, of looking at various work streams. We were able to get this initiative around 50,000 nurses into the Job Summit on the 4th of October, and there are follow-up discussions around the funding of that. So I think there are moves afoot to energize and to put constructive processes in place. Obviously, from a private sector point of view, we'd like to do it today.
Yes.
Yeah.
We understand there's certain constraints, of course.
So just maybe coming back to the investment, 600 million that you guys were doing, how do you balance the value that you're giving to shareholders versus the value that you want to give, as a healthcare professional, the socially responsible initiatives that you'll do working with government? I mean, I'm assuming this investment is going to go into things I've seen, like IBM working overseas with Watson, very, very effectively with hospital groups in the US. You make this investment for Netcare, obviously you representing shareholders as well. At what point pushing that onto government, into state hospitals, does that influence the quality of service that you guys can deliver, or your competitive advantage as a private group?
I think firstly the digitization of our entire network and being able to give patients an electronic record for life, and also being able to use that data, because I think we all know the advantage of artificial intelligence to predict and to prescribe and to get better outcomes for the patients will be a huge competitive advantage. We're trying to do what Warren Buffett says, is you build a moat around your business and you try to develop that competitive, sustainable advantage. And following other business models globally, we think that's exactly the reason we're doing what we're doing, and it will result ultimately in better outcomes.
And how much would the public sector healthcare then benefit from those client records for life? How much of a sharing of that technology would be done through a public
We'd
program?
be delighted to share our technology, our policies and procedures.
Does that not influence the moat that you have to an extent as well?
No, because I think this market is enormous, and I think that government's responsibility really lies with those 24 million South Africans who earn nothing and are unemployed. But we have about another 24 to 30 million South Africans who are employed. And only 8.8 million of those lives are covered by medical aid. We think there's an enormous opportunity for the private sector to start offering care to those patients that are employed but uninsured.
Yeah, and I think part of Gary's question also relates to how you're going to price the services that you provide for those patients that are going to come from the government side, and whether that's likely to impact on your ability to deliver earnings, that where you measure you every 6 months and we say, are you giving me the money?
Yeah, it seems like, I mean, I don't envy you. It's an incredible juggling act to do, and it's just interesting to see how you do it.
So we were successful in doing that in the United Kingdom. We led the very first waiting list initiatives in the UK. I was part of that in 2001. We ran a very successful business in contracting with the NHS and providing large schemes. For instance, we did 44,000 cataracts for the NHS in mobile vans for 5 years across the country. We ran surgical centres. And if you look at the business that we were invested in, 42% of the patients we saw in general healthcare were NHS patients being charged a national tariff, which was the same tariff that government was being paid, that the NHS hospitals were being paid. And all we were being judged on was the quality we provided. And we were able to make a reasonable margin and a return on that. So we've been able to show
make up for the price decline, because
clearly there's a volume price arbitrage. Of course there is. And one has to modify the business model, but at the end of the day, you've got to be able to provide the most outstanding care. And it's almost like the low-cost airline model, if you'll allow me.
Yeah.
You fly first class to London, I'm economy, I'm in the back. You can watch a whole lot of videos. I get a small little pack to eat. You've got a 3-course meal. But the pilot's the same. The surgeon's the same. The stewardesses are the same. The nurses are the same. And we all arrive at our destination. So the quality outcome's the same. That's the kind of healthcare we're trying to promote as Netcare.